If you're watching this, perhaps you or someone you care about is navigating the difficult landscape of depression. It's a word we hear often, but its true weight and complexity are sometimes misunderstood. Let's talk about what depression really is, and importantly, what it isn't. Depression is a serious medical illness, not a sign of weakness or something you can just snap out of. It affects how you feel, think, and act, and can lead to a variety of emotional and physical problems. It's more than just feeling sad after a bad day or experiencing grief. Clinical depression involves persistent feelings of sadness, loss of interest, or emptiness that last for weeks or longer. These feelings can interfere with your ability to function in daily life. It's a condition that requires understanding and often professional help. Symptoms of depression can vary greatly from person to person. Common signs include persistent sadness, anxiety, or an empty mood. You might lose interest or pleasure in activities you once enjoyed. Other symptoms can include changes in appetite or weight, difficulty sleeping or sleeping too much, fatigue, and decreased energy. You might experience feelings of worthlessness, hopelessness, or excessive guilt. Difficulty concentrating, remembering, or making decisions are also common. Physical symptoms like headaches, digestive problems, or chronic pain that don't have a clear physical cause can also be linked to depression. If you recognize several of these symptoms persisting for more than 2 weeks, it's important to pay attention. One of the most painful aspects of depression is the feeling that it's somehow your fault. Please know, this is absolutely not true. Depression is a complex illness influenced by genetics, brain chemistry, life events, and other factors. Depression is multifactorial, with biological, psychological, and social contributors. Genetic predisposition. Family history increases risk. Neurochemical imbalances, especially serotonin, dopamine, and norepinephrine. Hormonal changes, for example, postpartum, menopause, thyroid disorders. Chronic stress or trauma, abuse, neglect, PTSD. Medical conditions, chronic illness, cancer, cardiovascular disease. Substance abuse, alcohol, drugs. Major life events, divorce, loneliness, loss, financial hardship. Now let's dive into the types of depression. Number 1, major depressive disorder, MDD. Most common, severe symptoms. Number 2, persistent depressive disorder, dysthymia, chronic, less severe. Number 3, bipolar depression, depressive episodes within bipolar disorder. Number 4, postpartum depression, after childbirth. Number 5, seasonal affective disorder, SAD, related to seasonal changes. Number 6, psychotic depression, includes delusions or hallucinations. Number 7, atypical depression, mood reactivity and other specific features. Number 8, situational depression, triggered by stressful life events. Globally, as per World Health Organization, in 2023, approximately 280 million people were affected by depression. It was considered the leading cause of disability worldwide. Women are about twice as likely to experience depression as men. Suicide. Over 700,000 deaths per year were linked to mental health disorders. In youth aged between 15 to 29, depression is a leading cause of illness and disability. Diagnosis is clinical, based on patient interviews and symptom checklists, for example, PHQ-9, DSM-5 or ICD-11 criteria. Exclusion of medical causes, for example, hypothyroidism, anemia. No definitive lab test, but blood tests may rule out contributing conditions. Treatment of depression includes: Number 1, pharmacological. Antidepressants. SSRIs, for example, fluoxetine, sertraline. SNRS, for example, venlafaxine, duloxetine. Atypical, for example, bupropion, mirtazapine. Tricyclics and MAOIs, less commonly used. Mood stabilizers or antipsychotics for bipolar psychotic depression. Number 2, psychotherapy. Cognitive behavioral therapy, CBT. Interpersonal therapy, IPT. Psychodynamics therapy. Group or family therapy. Other treatments. Electroconvulsive therapy, ECT, for severe or treatment-resistant cases. Transcranial magnetic stimulation, TMS. Ketamine esketamine nasal spray, FDA approved for resistant depression. Latest research highlights, as of 2024-2025, 1. Psychedelic assisted therapy for example, psilocybin (MDMA), shows promise in clinical trials for treatment-resistant depression. 2. AI-driven diagnosis tools using speech and facial recognition. 3. Microbiome gut-brain axis research suggests gut health may influence mood. 4. Digital CBT apps are being validated as effective interventions, especially in remote or underserved areas. 5. Ongoing trials on gene-specific responses to antidepressants for personalized treatment. Prevention includes early intervention in at-risk groups, youth, postpartum women, mental health education in schools and workplaces, stress management and resilience training, promoting social connections and community engagement, regular physical activity and healthy diet, screening and primary care for early detection. If you are struggling, please know that you are not alone and help is available. Talking to a trusted friend or family member can be a first step, but professional support is crucial for managing depression. Mental health professionals, like therapists, counselors, or psychiatrists, are trained to help you understand and navigate these challenges. They can offer various treatments, including therapy, medication, or a combination of both. Don't hesitate to reach out to your doctor or a mental health service. There are also many support groups and helplines available that can provide immediate assistance and connection. Living with depression can feel overwhelming, like being stuck in a dark place, but it's vital to remember that recovery is possible. With the right support and treatment, people can and do get better. Healing is a journey, and it takes time and patience. Be kind to yourself throughout the process. Celebrate small victories, and remember that even on the hardest days, there is potential for light and healing. You deserve to feel well, and a brighter future is within reach.